Hello, welcome back. I'm Dr. Paul. So, I thought about making these videos so that we'd have a way to continue training, even if we can't seem to meet together. I'm also using the videos as a way to help me train and articulate what's going on in each part of the test. This is part 5 on the evaluation of the test to see if we have good test and good data so that we can move on to interpretation. So after this particular video, we will move on to interpretation. So this is part 5, and we're going to look at heart rate recovery. Pretty straightforward, so let's get to it. Close that out of the way. We'll again look at one of our screens. So far we've covered 1, the length of the test, 2, the heart rate slope, 3, the RER, 4, the anaerobic threshold if it was reached, and number 5, heart rate recovery. And of course, most of us know that it sits over here on the left side, that at the end of the test, it records from the peak heart rate, and 1 minute goes by, and then it records the heart rate after 1 minute. So this is called heart rate recovery, and it's there. So let's look at why it might be valuable to us, or why it is valuable to us. I'm going to jump over to our website here. So we're under resources, and under resources, if we scroll down, we see research on heart rate recovery after exercise. So I'll just read these. Attenuated heart rate recovery after exercise, testing and risk of incident hypertension in men. Number 2, heart rate recovery after exercise is a predictor of silent myocardial ischemia in patients with type 2 diabetes. Number 3, heart rate recovery immediately after exercise as a predictor of mortality. Number 4, heart rate recovery following maximal exercise testing as a predictor of cardiovascular disease and all-cause mortality in men with diabetes. Number 4, post-exercise heart rate recovery and index. And number 5, exercise heart rate reserve and recovery as a predictor of incidence type 2 diabetes. So we have quite a bit of information, and this was only a few of the studies that I've gathered, and I have some further information here. We'll go back to our screen. So the next one I have is, after studying and looking up heart rate recovery, I found a chart that I thought was helpful, and this is heart rate recovery, the numbers. If it's greater than 20 beats in the first minute, that would be considered pretty superior. If it's 18 to 20, that's excellent. If it's over 15 in the first minute, that's good. If it's over 12, it's fair, and then under 12 beats in the first minute is poor. So the reduced heart rate recovery interpretation is 15 to 18 beat reduction in the first minute is considered normal. Under 12 beats in the first minute is considered poor cardiorespiratory fitness and at risk for cardiovascular events. It is also marked by poor aerobic fitness and health, EPOC, which is exercise post-oxygen consumption, which means after you finish exercising, it may take 15 minutes up to 2 hours to regain your oxygen supply through your body. We find also that obesity impedes heart rate recovery. It is a predictor of type 2 diabetes. It's an increased risk for hypertension in men, and a higher resting heart rate values, which I find really interesting, a sign of potential hypertension. So the heart rate recovery could also mean that there might be higher resting heart rate values, which I thought was very interesting. So this is why we are recording it and bringing it into our interpretation, because it definitely has some health related interpretation data that we're going to use when we interpret the test results on one of our patients or athletes or our client. And so that's pretty straightforward. I just wanted you to be aware of it, that we want to get that data, and it'll fit into a much larger interpretation or a more systemic overview of interpretation. And that's all I got to say on that. Okay, I thought we'd just look through a bunch of heart rate recovery numbers together, so let's do that really quick. Down I go, and up this one goes. And the first one we see is Elia here, and we look 28%. From 171 to 144. Let's move on. Next one we see is 5%. This is on Christian. Obviously, I don't think we got that one right, so we'll skip that one. We have Neil at 19%. Mary Ellen at 86%. Mary Ellen, this was afterwards, 49%. Her first test was a little strange. Moving right through. Kathy, 31%. Paul, 25%. Claire, 66%. We're not sure that we got these numbers all correct, but we're working on it. Richard, 46%. Carrie, 23%. Now we look at Ted. This is very interesting because Ted, we know, has congestive heart failure, and we see 12% there. And if we look at the beats, it's only a 2-beat difference, and he definitely falls under the 12-beat approach. But of course, there's also the issue of beta blockers that are affecting all this. We look at the next one. Ladov's 22%. Tricia at 37%. 16% for Joel. He's a friend of mine, and that was interesting. 60% on Gail. 33%. Anyway, you get the idea. So it's definitely worth studying it. All right, just wanted to share that with you so that we knew what we were kind of doing there. And we'll stop there.